this is not too bad. So repair, wound healing, all right? So there's 3 phases, all right? Inflammation, then we have this granular tissue formation, and then we got wound contraction and finally remodeling. That's what happens with all kinds of wound healing or wound repair.
The primary objective of the healing process is to fill the gap created by tissue destruction and restore the structural continuity of the injured part. Wound healing is commonly divided into 3 phases: the inflammatory phase, the proliferative phase, and the remodeling phase. During the inflammatory phase, inflammation aims primarily at removing the injury-causing agent and limiting the extent of tissue damage as it prepares the wound environment for healing. Inflammation is manifested by redness, swelling, heat, pain, and loss of function. The phase begins when smaller blood vessels near the site of injury constrict briefly before they expand. Then the vessels dilate, promoting congestion. An accompanying increase in capillary permeability leads to the movement of fluid into the affected tissue. Increasing viscosity causes the blood to flow more slowly, and clotting occurs. Phagocytic white blood cells or leukocytes emigrate through the vessel walls into the inflamed tissue, where the leukocytes engulf and degrade the bacteria and cellular debris in a process called phagocytosis. Phagocytosis is part of the immune mechanism to prevent an infection that would impair wound healing. Subsequently, growth factors are released, leading to the second phase of wound healing, the proliferative phase. During the proliferative phase, the focus moves to the building of new tissue to fill the wound space. The third phase of wound healing is the remodeling phase. It begins after about 3 weeks and can continue for 6 months or longer. During this phase, scar tissue is being formed. Scar tissue may achieve 70 to 80% of tensile strength by the end of 3 months. Wound healing consists of filling the gap created by tissue destruction, followed by restoration of the structural continuity of the injured part through 3 phases of healing: the inflammatory phase, the proliferative phase, and the remodeling phase.
There's 3 types of healing over here. Primary intention, that's the best kind. That's owing to the surgeons doing it. When they take a clean, sterile scalpel and they make an incision in there, it's straight. There's no bacteria on there. And the surgeon will sew it in a way that it'll heal nicely. That's what we call primary intention. But we see more of the secondary intention, which is, you fall off your bike and now you've got this big cut there, and some tissue has been gouged out, so to say. So you may have a scar there. You usually don't have a scar much over here. This you'll have a big scar. This might be just like a little white line. This might have something where it's going to be higher than usual. Right? To quote the cubitus ulcer, you should have put one of those pictures on here. It's pretty grotesque. But you'll see it. Just type in bed sore. You'll see some pretty grotesque ones. And tertiary intention is when you have a large gap of missing tissue that has happened, but we need to, it's also contaminated with bacteria. So we usually have to put a drain in there, which is like this tube that goes into there, and then all the pus and all this exudate will drain out of that tube, and we'll keep that in there for a few days or a couple of weeks, whatever we got to do, until all that's cleared out. So that's more intense. And this is just showing you 2 types. You can see here, primary intention, the surgeon kind of stows it up a bit, but when you get a gouge like this, you're going to have a nice scar on that. All right, so there's 2 types of wound repair. You either do regeneration, where it just grows back and you can't see anything. A good example of this is a rug burn. You slide off and it's just the upper layer of your skin that came off. All right, it'll grow back and doesn't leave any scars. It just regenerates there. Okay, that's an easy one to understand. Healing, you'll have regeneration and fibrosis. That's a scar formation. or it might just be fibrosis. Depends on how nasty the cut is or the laceration is. Okay? So regeneration is, like I said, a rug burn. And in this case, through mitosis, the cells just reproduce their own cells, and it looks beautiful. Okay? So it only happens in cells, as I talked about before, that can go through mitosis. The skeletal muscles, cardiac muscle, and nervous tissue, if you destroy that, you're not going to be able to fix that, right? Because they can't go through mitosis. So in these kinds of tissues, they can only go through scar tissue, fibrosis, and that can actually blockade certain things. For instance, if there's some kind of scarring that happens with cardiac muscle, right? Someone has a heart attack, and now you got a big scar that happened over there that fixed itself naturally. What will happen is if it's in the realm of where the Purkinje fibers are, where electricity needs to go through, if there's a scar tissue over there, the Purkinje fibers can't go further than that. So it interrupts. So therefore, over here, you're not going to be able to squeeze the heart, right? So same thing with, let's say, nerves. If, let's say, the neuron gets destroyed. Well, you can't, it gets scarred over there. It's not going to work, right? So you got to think in terms like that. All right, so this is where the tissue over here, this is epithelium, so it kind of just, through mitosis, it would just make its own cells, and like a rug burn, it would just heal itself. Okay. Fibrosis or scar formation, there's 3 steps over here. You have cell migration and proliferation. What's happening here is that the myofibroblasts, they proliferate, they multiply, and they begin producing collagen. Right? Fibroblasts will make collagen fibers, the elastic fibers that are used to make that. Right? And it fills in the space not occupied by the surrounding cells. Then the next thing you need is that you got to build roadways getting over here. You've got to be building new blood vessels to get the nutrients and oxygen over there. You've seen this whenever you cut yourself, or you saw someone that cut themselves. If you cut yourself, you got that, I call it nice pink tissue. You know what I'm talking about, that pink tissue where it started? It's like new tissue. And if you touch it, it's very sensitive because the neurons are trying to grow back into that area. They're not making more, they're just trying to grow back into that area. But it's very sensitive, and it's green, it's that pink new tissue. That's called, that's where all the blood vessels. It's pink because new blood vessels are growing in there, all right? You can see it pink because it's thin, because this is still happening too. You know what I'm saying? It's very thin, so you can see it's pink, it's red. After that, then scar development is going to occur, okay? Myofibroblasts will generate connective tissue matrix, kind of pull the wound together, all right, wherever that's going to be, and you're going to have this scar that will remain there, so to say. That's fibrosis. But these 2 things over here is going to develop that pink area I was just telling you about. It's called granulation tissue. Oh, it's wonderful. That's what you want to see. Granulation tissue is an area where you know that blood vessels are moving in on there. That's going to say that's getting a lot of oxygen. It's healing well. Okay? You can do the steps over here where fibrosis is. And scar formation, and the same thing over here where it's building that over there. Here's the scar formation over here and regeneration. So these are factors involved in wound healing, whether good or bad wound healing. All right? Nutrition, God bless you. Nutrition, all right? Zinc and vitamin C, in theory, when there's high levels of that in the body, healing happens very nicely. Drinking orange juice, take it with your zinc pills. Should work. Does it work all the time? This is a Dr. Oz thing. It's nice, but how much zinc do you put in there? You know what I'm saying? How much orange juice do you drink? You know, is it really going to where the wound is, or is it just making expensive urine? Right? You have to just think like that. So, but oxygenation, have it well oxygenated, circulation. You have a good immune system. Right? Older people, it's going to take longer for that to happen because their immune system goes down. Diabetes, their immune system kind of goes down too. So we'll get into those later. Corticosteroids, if you know that decreases inflammation, you got to have a decrease of this immunocompromised or immunosuppressant medications, contamination, obesity as we get older. All these different things will play factors in good or bad wound healing. Okay? And lastly, I want to do is complications of wound healing. These you should know, hint, hint, right? Keloid is hyperplasia of scar tissue. It's an overproduction of scar tissue. I'll show you a picture of what that looks like. Okay? Pyogenic granuloma is highly vascularized or persistent granulation. That granulation should go away. It should be covered by a new epithelial tissue. Okay, so that's what happens with that. Contractures. All right, this is where you see this a lot of burn victims. They're all contractures, those skin, and you can't really move them, that kind of stuff. Dehiscence. I've seen a few of these. Dehiscence is where, let's say, they had a C-section, but after about 2 weeks, it opens up. That's what wound dehiscence is that it opens up. But the tissue underneath is still attached. It's just that it opened up and you see all the adipose tissue. Right? That's not a good thing. You've got to fix that, right? The evisceration is where there's a wound dehiscence, but there's insides coming out. That's not good at all. I saw one case of that. That's not a good thing either. We got to fix all that. All right? A stricture is abnormal narrowing of tubular passageway. For some reason, if there's kinking going on with a tubular thing, let's say an intestine or blood vessel, it kinks, or there's some kind of stricture, it's getting thinner and thinner. Now it can't get through, now the food or the blood can't get through there. That's what a stricture is all about. A fistula is where there's an abnormal connection between two tubular things. So if this is going to be your artery over here and a vein over here, they should be separate. But for some reason, if there's going to be some sort of connection between the two, an abnormal connection, not good. That's called a fistula. That's called a AV malformation. And very common we see in elderly people in the abdomen. So that's what happens with that. And then you've got adhesions. Who here has heard of adhesions? Adhesions. This is basically what's, anytime you do a cut or something like in the abdomen or something, when you do surgery in there, for some reason you have to make sure the healing is done in a nice way, and it's difficult to do this even with the best surgeons. So it's difficult to avoid these kinds of things. If I cut right here, then you should be able to put it back together like this. But sometimes it'll go on like that. You just can't help it. You just can't. It's just one of those complications that can happen. But because it's raw over here, this area, if it sticks to something, it'll actually cause a scarring between the two other areas. Does that make sense? Right? It's raw over there. So, and when that happens, you get a lot of those adhesions, it becomes more like a spider web. And now it can kink certain intestines. I've seen it so bad that the pelvis, the uterus and fallopian tubes, we call it a frozen pelvis. There's so much adhesions in that area. And it was not because of surgery, it's because of something we're going to talk about much later, pelvic inflammatory disease. But there's so much of adhesions that you couldn't even move it. And it was causing a lot of pain. It was pulling on things. So that's what adhesions is. Problem is, every time you could also cut the adhesions so that because it's not really, it's a very thin membrane that actually is there. So when you cut it, there's no blood vessels in there. But every time you cut it and do surgery, expect that there's going to be more adhesions because it's more surgery. So I just want to show you what a picture of keloids are. This is keloid. Now this is actually nice granulation tissue. That's what I meant by pink. The problem is it's persistent. It stays there. There should be some of this skin growing over that. It shouldn't stay like that. That's what a keloid is. It's this persistent, excessive amount of granulation tissue. You can see it over here. You see it more in the black population. It's just more prevalent over there. But also, I see it a lot too behind the ear. Why? What do you think? Any kind of trauma, any time that there's going to be any kind of scar formation, and you're a keloid former, I'm sorry?
Is it piercing or is it?
It's the piercing, yeah. That's why you see it. I see a lot. I'm there in the checkout counter of the supermarket, and you know I can't help it. I just look at people and I can diagnose. I don't tell them that. It's just the way I'm trained. I already know what you have. I know what you have. I know what you have. No, but the thing is, it's just the way so I'm just sitting there and I'm just saying, oh, keloid corner. I don't say it, and I just it's just because of the way when you get into medical field, you just see different pathologies. So that's what happens over there. And in fact, some tribes in Africa, if they're keloid formation, they kind of do it like with tattoos. It's like they actually purposely put scars on there, developing them. Whatever works best. All right, so that's it. That was the 2 hours. It's a lot of material.